Good morning and welcome again to the Bipartisan Policy Center. Thank you very much, Congressman, for your comments. Thank you, Senator Frist, secretaries co-chairing this particular task force, and all the task force members here. This was an exercise in love, but also it was a little difficult exercise, and we have some controversial proposals to discuss. For the audience, I'm going to have a short discussion here with the two secretaries. They'll leave the stage. The task force members will come up here. They'll go through their panel, and then the two secretaries will rejoin the panel for any questions that you might have going forward. First, before I begin, and the Congressman just left, but can we just, do you have any reaction to, I didn't want to, I want to say the elephant in the room, or the elephant, hit the bipartisan policy, the elephant and the donkey in the room here. I wasn't going to go there, but maybe we should just get the harvest box out of the way real quick. Before we get into the recommendations, you want to make any comments, either of you?
Sure. Well, I think Congressman Panetta really addressed this issue quite significantly, in that, the practicality of it is a real question. I know that the states that administer the programs and would be required to individually administer these programs, the Harvest Box program, are very concerned about how this would work. I think if they're going to go down this road, probably one or two pilot projects to show how it would really work is something that could be considered. But now it is a very difficult program for the states to try to administer and get their arms around, along with all of the issues that Congressman Panetta brought up. I think Congressman Panetta made very important points that are relevant to what we're discussing today. One, he talked about the importance of healthy eating, about the nutrition part of the Supplemental Nutrition Assistance Program. Number two, he talked about the importance of evidence and data. And three, he talked about the importance of education. And these are all things that are addressed in our report, and I think he underscores the importance of how we're trying to use this report to improve nutrition, to improve healthy eating, to improve public health, so that overall we reduce healthcare costs in this country.
Overall, I think this Harvest Box idea is one of the worst ideas that I've heard of in modern times. First of all, we got away from making this program being a commodity-based program to a program where people can go into the grocery stores or the food markets and buy their food. And imagine the impracticality of a box containing, I'm not sure what would be in it, but it's pretty hard to imagine fresh fruits and vegetables in the box. How are we going to deliver it? Are we going to ask Amazon or a modern drone company to come in and drop the boxes in people's homes? Maybe. I think that's probably pretty impractical. And I can't imagine this saving any money, although I presume that this was a budget decision in part made by the administration to save some dollars. But we're going to keep part Harvest Box, part non-Harvest Box, and it will all be enveloped with confusion. And so I would say this is probably a program that is on thin ice, if it's not already fallen through the ice.
Good, thank you. Let's get specific. First of all, I was going to spend a little time, but I won't. Oh, there they go. These are real coupons here that I'm old enough to have remembered when we did this. And I think I heard this morning, and I did not realize completely, under Secretary Veneman's leadership, and all states became to the EBD type approach. And so I think to Secretary Veneman's work there at USDA to be complemented as we moved to a more electronic way and moving technology. But we do have some recommendations there. First of all, let's say there's well over, I think, 15 specific. We're not going to have time to go through all of them. Some will be covered by the next panel. But let me just ask, of the recommendations, Secretary Glickman, which one would you want to highlight as for the audience here today that you consider to be one of the more important ones?
Well, you talked about the elephant in the room. Perhaps the
donkey.
Donkey, okay, all right. I'm thinking
we got to keep this bipartisan.
Perhaps another large animal in the room is the issue of sugar-sweetened beverages, and our feeling is that we think the Department of Agriculture should have the authority to go through all the evidence, because it's an evidence-based decision, and decide which beverages in that group have virtually no nutritional value to them, and they ought to be eliminated from the SNAP program, as are some other things like hot meals and alcohol and tobacco and other kinds of things. That's going to clearly be a large animal in the room, because it's controversial for a couple of reasons. Some people think that makes people recipients on SNAP second-class citizens because they can't choose to buy sugar-sweetened beverages. But the evidence led by Dr. Frist, who's done so much work in this area, if anybody can know what's inside a human body and sees what the impact of some of these things, he can see it. And the fact is that medical costs associated with this as part of the diet is so great that I think it outweighs the other side of the issue. But clearly that's a subject that's going to be discussed. Subject of how retailers are going to have to be dealing with these issues are going to be discussed. But it has to be accompanied by the incentives for better consumption of fruits and vegetables. And realizing our diets are complicated. You just can't live on fruits and vegetables. You need protein sources. You need a broad variety of foods in everybody's diet as well. So we're not advocating that all we eat is fruits and vegetables. But the fact is that the evidence is pretty clear here, and I think that's probably going to be the largest issue that we're going to have to deal with, as was your commission that had to deal with that same issue.
Madam Secretary?
Yeah, I would fully agree. I mean, I think the report really advances a number of issues, but the most important thing is to really look at how is it helping to provide nutrition. And sugar-sweetened beverages really are an important first step in looking at what are the food stamp or the SNAP recipients buying. In the general population, sugar-sweetened beverages, according to a study of USDA, is the number 5 product that people buy. In the SNAP program, it's the number 2 program. 9.3%, according to this USDA study, of SNAP dollars are spent on sugar-sweetened beverages. That's more than is being spent on vegetables. So that if you spent that amount of money that you're spending on sugar-sweetened vegetables sugar-sweetened beverages on fruits and vegetables, you would have a much healthier population, and hopefully you would see the costs of healthcare declining as a result. And that's really what we're trying to do, is how do we improve health in this country? Lifespans in this country are actually going down rather than going up. I mean, that's a really sad commentary on what's happening from a health perspective in this country. I think the other issue that's really important about the report is we're calling on government to really look at how can you coordinate government programs dealing with public health more effectively. We don't coordinate in the U.S. government Medicaid recipients and SNAP recipients. Now, to some extent, some states are doing some work in this area, but it's not enough. We need, from the federal government perspective, to really focus on how do we link public health in the SNAP program with public health in the Medicare program and other health programs in the government.
If I just may add one other thing, too, is that what's good for the goose is good for the gander. Obviously, everybody can buy sugar-sweetened beverages, and I do myself. But the principles laid out in this report can kind of serve as an incentive for the general population to look at what they're consuming in their diet as well, for the retailers, nutritionists, physician community, public health communities, corporate communities. And so while our recommendations are geared to the SNAP population, because that's where the public dollars are going into, all Americans need to look at these recommendations.
It was my last boss on the Hill, Dr. Frist, who called me about 2 years ago and said, what's this organization doing about linking up our federal food programs with the growing cost of health care in this country. I'd actually like to point out, as an old budgeteer, that the cost of at least the projections on the federal food SNAP program, here I am still on the food stamp board, SNAP program is relatively flat. Is flat, in fact, at about $70 billion. And participation has declined rather dramatically because of the growth in the economy. While there's no growth in the cost, at least projection of the SNAP program, the cost of Medicaid is growing at close to about 4.5%, 5% annually, well above the rate of growth that's projected in the economy. So that the issue of focusing, if it is a budget issue, this is not the budget issue that we should be focusing on. We should be focusing on that which is costing us money, which is, of course, the health care programs. And that's why I think your study is so good in terms of focusing on making this program even better and helping us reduce the cost in the Medicaid program. So thank you for,
Can I just mention one other thing? See, we have 1 minute and 18 seconds.
We really got
okay. And that is that the big chunk of people on SNAP are families with small children. You can imagine the impact on their lives as they grow up. But the other thing is the number of people, thank God, living longer, number of elderly people, many of whom suffer from chronic diseases. And the issue of veterans was issued before. But our recommendations really go to this broad variety of people who kind of come in and go out of SNAP, depending upon more global economic conditions, and how to set some standards for them so that they can live their lives better and longer and healthier and not have to go through cardiovascular surgery by Dr. Frist. And that is such an important point to be recognized. All the people who are involved in this issue, including the anti-hunger community, is that this is not only an anti-hunger issue, this is a health care issue as well.
I've been told we have a couple, they'll let us have a couple more minutes,
right.
Secretary. So I can't resist this. You've both been through the quadrennial exercise of a farm bill a number of times. You heard what Congressman Panetta said. This is usually a bipartisan issue. Do you think there's a possibility that some of these recommendations might actually make it into a farm bill this year or not? Or are we going to go through the argument that I hear everyone? Maybe we should just take this food stamp title, the SNAP title, out and have it not be in a farm bill. Any thoughts?
Well, I think Congressman Panetta made the point that if you don't have the two linked, it's going to be very difficult to pass a farm bill. And I think we would just underscore that comment. And certainly that would be one of the issues. But I think that when you ask, is there a possibility that some of these things could be discussed? I mean, the one thing about having the harvest box as a totally radical idea that nobody thinks will work on the table is that maybe the committee will be open to looking at some other ideas to improve the effectiveness of the program and the nutrition of the program. And we hope that our report will be a basis for some of those changes that might be made. This report really, isn't intended to be the final product of where we ought to go with a, public health program like SNAP, but rather it's some first steps to make it more effective and to make it more focused on nutrition.
I would say by the way, if you split the SNAP and nutrition programs from the farm programs, it could be the death knell of both of them. And we've both been through that issue. But second of all, some of the issues I think can make it through this farm bill. Improving SNAP Ed, providing additional incentives for people to eat better foods of all types, the Medicaid coordination. Those are things that maybe we can put in this farm bill. The sugar-sweetened beverages, that's going to be controversial. I know that. It's the right thing to do from a health perspective. And I've been involved in the anti-hunger world for some time. I know there are a lot of folks who worry about this. They think, well, give an inch, take a mile. If you deal with sugar-sweetened beverages today, it's potato chips tomorrow, and it's the wrong kind of vegetables the day after tomorrow. I don't think so, because as we put in our report, the evidence is that sugar-sweetened beverages are, in fact, different, have a huge percentage of costs and payments made for them. But at least the debate starts, And nutrition being part of that debate is really critical.
Thank you very much. Thank you very much for your service. And they'll come back to the stage after the next panel so they can answer any questions that you might have. So Hannah, will you take it over from here? I should say Hannah was our project director on this and did a major effort of bringing this all together. So thank you, Hannah.